Hi, Dr. John Ziegler with you today. We're still talking about plantar fasciitis and heel spurs. Today we're going to be talking about two therapies that we have at our clinic that can really help with this. And this is one of the main reasons why I even purchased these two machines was because of the amount of people that have plantar fasciitis. Now, we have a class 4 laser. There's different lasers, but class 4 is as high as you can go before you get into like surgical lasers. It's incredible for decreasing inflammation and helping tissue heal about 40% faster than without it. And so we want to be cutting edge as much as we can. So we have an Aspen laser. We're going to demonstrate it in just a second and show you exactly what this laser can do. It's very comfortable. There's no pain associated with it, but it's incredible how it can help the body heal. The second thing that we have is a Shockwave machine. We have the PosiWave 2 Shockwave machine. This machine puts an acoustic pulse inside there to break up the heel spurs. So if you remember when we showed the x-rays before, that big heel spur sitting on the bottom of the heel, this will come in and kind of help break up that heel spur and allow mobility of the tissues. Very good for everything from tendonitis, bursitis, heel spurs, osteoarthritis. This is a phenomenal machine. And again, a lot of patients come in and they can't walk, and within about 6 to 8 treatments, they feel great in the bottom of their feet and they're able to get back to their normal activities. So we're going to demonstrate those for you today. And again, please give us a chance to help you with this. This is the worst kind of pain that you can have. Anybody who's experienced it can tell you they wouldn't wish it on their worst enemy. But we have these two instruments that will really help you and help you get back to having a pain-free life with a lot more function. So let's get to showing you how these work. Okay, now we're going to show you what class 4 laser looks like on a patient. I don't know if you can see, but there's a little red light on my hand. That just kind of tells me where the laser's at, but when we do turn the laser on, it's going to have a pulse sequence to it like that, and we're going to be putting it on the bottom of the foot. We'll have to wear glasses, both myself and the patient, because you can damage the retina with this type of therapy. However, it's very safe as long as you wear these glasses. It feels very good. You'll just feel a little warmth on the bottom of the foot and it doesn't hurt at all. So let's start this treatment on this foot. Again, we're going to be running this up and down the foot slowly. And all we do is just start there and just run streaks up the foot. Nice and slow. And this is just breaking up some of the scar tissue. It's also causing a decrease in inflammation and a decrease in pain. And we ask the patient for feedback. You know, if this thing gets too hot, let us know. But in general, as long as we keep this moving, it feels very good to the patient, and it does a great job of decreasing inflammation and increasing healing time by about 40%. So it's a very safe technology. It's been around for over 60 years. And this is, again, a class 4 laser. And we're the only one in the area that has this. But we've seen phenomenal results using this laser on all kinds of different conditions. But plantar fasciitis is definitely one that it is rated for. So this is how we treat. And you can see the patient's not in any discomfort, and it does very well. Okay, like I said, there's a couple of therapies that we use along with adjusting. We always want to adjust the foot. We have to get the joints in the foot in proper alignment so that when you are using your foot, it functions properly within those 3 arches that we talked about. The first therapy that we're going to use is Shockwave Therapy or acoustic compressive therapy. This therapy basically uses a pulsed sound that goes through this cone, through the foot, into the area where you have the heel spurs or the scar tissue from the fascia. This technology has been around since 1984. It was initially used to break up kidney stones, and it's still used today for that. However, this instrument, even though not as strong as what they use to break up kidney stones, same exact therapy, just used in a little bit downgraded compression force. And so we use this along with the laser therapy that we'll show you in just a second. That combination, this goes in and breaks up the heel spurs and the scar tissue. The laser also helps with that, but also decreases pain and inflammation. We'll show you that in a minute. And that, along with the adjustments, also doing the foot exercises that we will show you and the proper footwear, we can help you get function back in your life and decrease pain. So let's show you how this works. Basically, we're going to be asking feedback from the patient. We're going to put this in an area where we're looking to use, and we're going to turn it on. That clicking noise that you're hearing is basically the compressions going through into the foot. A lot of times initially we'll kind of move it around trying to find where the worst scar tissue is at, and it'll have a little bit of discomfort when you find that area. We always ask for feedback from the patient. We don't want any of the pain to be higher than a 5 to 6 out of 10. We're not there to put you in a tremendous amount of pain, but we do have to get in there and break up those adhesions. And so we'll move it around, and once we find that spot, we're just going to hold it on that spot. Normally we'll do anywhere from 2,000 to 4,000 compressions each treatment. Again, you're looking at probably 6 to 8 on average treatments to help this heal. I've had some patients where it was severe and we had to go up to about 10 to 12, but on average you're looking at about 6 to 8 compression therapies, acoustic compression therapies, and also about 6 to 8 laser therapies along with the adjustments. And then again, we add in the foot exercises and also the proper shoe wear, and this will help you. So a very effective therapy. It's been around for a long time, over 40 years, and it's very good at breaking up these adhesions. We use it for other things other than this, such as shoulder, elbows, knees, hips. It can be used almost anywhere. We can even use it in the scar tissue in the muscle, and it's a very good therapy. So I hope you allow us to show you and demonstrate to you how this can help you get your function back and decrease your pain. Next, we'll be going over the laser, the class 4 laser therapy, which is used in conjunction with this.